9-year-olds in their elementary school, partygoers at a Lunar New Year festival, farm workers in Northern California, and a 20-year-old who pulled into the wrong driveway with her friends. Those are just some of the hundreds of people lost to America's epidemic of gun violence just this year. The latter, the shooting death of 20-year-old Kaylin Gillis in New York, is also part of a troubling uptick in the Stand Your Ground shootings. And just days before her death, 16-year-old Ralph Yarl was shot in the head after ringing the wrong doorbell in Kansas City trying to pick up his younger brothers. He survived and is recovering. And just a few days later, 18-year-old Peyton Washington was shot in the back after she and a few of her teammates tried to get into the wrong car after cheerleader practice. She's also recovering. In those attacks, shooters are claiming self-defense using broad and vague definitions established in the so-called Stand Your Ground laws on the books in 30 states. And again, these cases make up just a handful of the gun violence incidents that we have already seen this year. We wanted to dig in deeper to this, the American epidemic of gun violence and other topics. I'm joined by Dr. Cornelia Griggs, Director of Education at Mass General Hospital Center for Gun Violence Prevention, where she is also a pediatric and critical care surgeon. Thank you so much for your time.
Thank you so much for having me.
I mean, I can't imagine what it's like for you to see these cases on the news, on social media and things like that, because I imagine as a physician, you know what it's take to either put those bodies back together or have to give bad news to families.
Yeah, absolutely. I mean, that is exactly what inspired our work in the Gun Violence Prevention Center at Massachusetts General Hospital. My colleagues and I just felt that we couldn't look one more mother in the eye to tell her that her child had been lost to gun violence senselessly and unnecessarily.
What are some of the main objectives here?
The main objectives are our center are based on the pillars of community, research, and education. And we have found that we've had a lot of success as a hospital-based initiative because we're coming at this from a public health standpoint. This epidemic of gun violence, as you mentioned, is a public health crisis in our country. And even here in one of the safest cities in the United States, in Boston, we are not immune to this epidemic. And the heart of our program is really centering our community voices as well.
Because I know sometimes this conversation, or most of the time, this conversation around guns ends up being a political one, rather than the folks who are on the front lines dealing with it in the aftermath, like yourself in public health. How do you guide the conversation so that it is centered in public health?
I think there are a lot of points at which most Americans can agree. And one of those points is that as a parent and as a surgeon, I want to be able to send my children off safely to school. We want people to be able to go to their churches, movie theaters, malls, and feel safe in those spaces. And I think that's a point that we've been able to harness at the Center for Gun Violence Prevention at the Massachusetts General Hospital and bring voices together across the aisle. We work with the Boston Police Department. We work with our community-based partners in the communities that are most affected in Boston, like Dorchester, Mattapan, Roxbury, Jamaica Plain. And we bring people together across the aisle as a hospital-based organization that's focusing on safety of our children and health.
So some of the projects in that, is it research-based in terms of like, is it surveys? Is it analyzing gun violence data, things like that? What does that look like?
It's all of that. It's
Yeah.
working at the meta level, bringing together large databases and using advanced modeling work with some of our experts at the School of Public Health to come up with broad-based solutions that would work on a countrywide level. And then it's working very locally with organizations like the Louis D. Brown Peace Institute, one of our major partners in this effort, because it's our belief as a center that those who are closest to the problem are also closest to the solutions, and really bringing them into the fold of academia and centering them and empowering our community partners to be driving policy changes.
You had mentioned, looking mothers in the eye. I mean, was there any sort of turning point for you or case that stands out that sort of illustrates what drives you towards this work? Because being a surgeon, being a pediatric surgeon, is already a full-time job. So doing this work as well, there must have been, at least one motivating story for you.
Yeah, absolutely. I think there was a moment in 2017 after the Sutherland Springs shooting where I was feeling so much despair as a parent and as a surgeon. And I just felt like I couldn't read one more headline without taking action. And despite being busy, I feel in my soul, in my bones, that this is a solvable problem in our lifetime. It doesn't have to be this way. And I think a lot of Americans are feeling just as frustrated as I was in that moment. But I can tell you that every loss of a child, every loss of life to gun violence is one too many. And it is a heartbreaking scenario to be in the trauma bay with a child that you cannot save because their life has been taken by a firearm. And I wrote a piece with my partner, Peter Masiakos, called The Quiet Room, which is a room where we go in the emergency department to tell mothers that we were not able to save their child. And it's those moments and the headlines combined that really inspired our work.
We know that gun violence or guns is now the #1 killer among children in the United States. There are more guns than there are people in the United States right now. I want to pull in another piece of data here as we talk about the Stand Your Ground law as well. The rate of homicide by firearm per 100,000 people in the United States with this law before and after it was enacted. So before the law, it was 0.36, after the law 0.39, and it may seem that that's just 3 decimal points there, but those are people. Yeah. Those are lives. Yeah. And this is just some of the data that the center is hoping to pull together to be able to tell this public health story.
Yeah, I think it's easy to become numb to those statistics over time, especially as they climb. And it's easy to be frustrated and to say nothing is ever going to change, but we feel completely differently in our center. We feel that it has to change. And we know that our community partners are experiencing gun violence at unjustifiable levels. And that's rooted in easy access to guns, and it's rooted in systemic racism and poverty as well. So the answers are not simple, the answers are not easy, and the answers can be frustrating because it's going to take a long time to unravel this crisis. As you mentioned, there are more guns than people, and the oft-quoted statistic that it's the #1 cause of death for children in the United States. But there are definitely answers, there are definitely solutions. A lot of it lies in policy change and changing easy access to guns. But a lot of it also involves investing in green space, investing in communities that have been systemically oppressed and marginalized. And we need to come together as physicians, as community members, as civilians who are frustrated, and stand up and raise our voices together to drive this change.
You mentioned green space. Is there a specific connection that you think people don't necessarily make when we're talking about health and gun violence that surprises people when you talk about it?
Yeah, what happens when people see these terrifying headlines about these statistics or another mass shooting or the horrible events that have happened in recent weeks that you described is it invokes a sense of fear and panic. And I can tell you that the answer to gun violence is not buying more guns.
Dr. Griggs, I want to thank you so much for your time today.
Thanks so much for having me.
Yeah.